we are continuing from where we ended the last time, and that would be the nursing orders and nursing interventions, because the last time we ended at the goals, objective outcome criteria. So today we are going to continue with learning how to write your nursing orders and your nursing interventions. The reason why I'm combining the orders and interventions is that when you write your orders, your interventions are just what you do with the orders. So it's basically the same thing. If your order is to check vital signs, your intervention will be vital signs checked and recorded. Are you getting it? So from our previous videos, we explained it, but like I said, here I'll just add a little bit to what we've already explained in the first video. And what I'm going to add is that, you remember in the first video I said that medical orders like medications and those things come after you are done with your basic nursing procedures. Why did I say that? I said that because when writing your nursing orders or the nursing interventions, always bear in mind that there are 3 types of nursing orders and interventions. These 3 types are, the first one is the independent nursing orders, the second one is the dependent nursing orders, and then the last one is the collaborative nursing orders. Do you remember where we met this? Yes, under the nursing diagnosis. It's the same thing. The independent nursing interventions focus on what the nurse or you as a nurse can do for the patient from your own autonomy, that is from your own power, within your own power, without waiting for an instruction from the medical doctor or the physician. So nursing interventions could be like checking the vital signs, bathing the patient, changing positions, and medicating the patient on condition, the relatives on medication, and all that. Those are independent nursing interventions that you have to do for the patient without waiting for the doctor to give you an instruction. So when you're writing your nursing interventions, always make sure that these independent nursing interventions come before you bring your dependent nursing interventions. Of course, the dependent will be the ones that depends on the doctor or the physician's orders. So make sure that because you're writing a nursing care plan, always your independent nursing interventions, that's your basic nursing procedures, always come before the dependent nursing intervention, that is usually the medical interventions or the medical orders. And then the third one, that is collaborative nursing interventions, are the ones that needs all hands on deck. So they are the ones that we need the lab technicians, we need the ultrasonography team, we need, you understand, all these people to contribute in making it a success. Those are the collaborative nursing interventions. Now, in writing your nursing intervention or your nursing order, always take into consideration, always bear in mind these 5 very important steps. The first step is that always ensure that your nursing orders are safe and appropriate for the client's age, health, and condition. Alright, so when you make sure that your client's orders are safe and appropriate for his age, you're going to ensure that certain things that you can do for a young adult in his condition, you cannot do that same thing for an older adult in the same condition. And you're going to understand that different conditions come with different nursing orders. And 2, ensure that your nursing interventions or nursing orders are achievable with the resources and the time available. You don't set goals that you cannot achieve with your available resources and within a particular time frame. That is impossible. Thirdly, always make sure that your nursing orders and interventions are in line with the client's values, the culture, and the beliefs. Ensuring that your orders are in line with the client values will make sure that the clients and the client relatives will fully participate in your orders. Other than that, if it goes against their values, you might end up not being able to achieve your goal because they won't help you. And the fourth one, make sure the nursing orders are in line with other therapies that the patient or the client is undergoing. Making sure that your orders are also in line with other therapies like physiotherapy, it can be diet therapy. All these are important in bringing the patient or the client to optimum health. So make sure that your orders will not interfere with these therapies, but rather it will help these therapies or work in conjunction with these therapies. And then last of all, make sure that your nursing interventions or nursing orders are based on nursing knowledge and experience or knowledge from relevant sciences, but not from your own perspective without scientific backing. And then don't just use your mind to create goals for the client. Don't just think up client goals or just conjure client goals from your own mind. Make sure that your goals are scientifically based and there's relevant knowledge on it and relevant sciences and proofs to ensure that it helps the patient. Now, when writing your nursing interventions or your nursing orders, always make sure that your nursing orders are specific and accurate. Go straight to the point and don't wrangle around. Make it specific and then clearly stated so that whoever picks it will understand it without having to call back for further information. Make it simple and clearly stated. And then always make sure that when you are using, listen very carefully, when you are using or when you want to use abbreviations in your nursing care plan, that is, if it is not for academic purposes, ensure that these abbreviations are understood by the facility that you're working in. Don't use abbreviations that the facility is not familiar with. And in fact, don't even use abbreviations, especially if you're a student, because your abbreviations can be misread by the next person giving a false information. So always bear that in mind. When we are done with our orders and interventions, the next one on our list is evaluation. There is nothing to talk about here. Have we done everything that we supposed to do? Have we implemented our orders? Yes, we have. So, did we achieve our goal or we didn't? Maybe we did, we didn't, we are still in the process. So the only thing that I will talk about here is what to say when you've evaluated your goals. So if the goal was achieved or if you were successful, you just go with goal successfully met or goal achieved. If the goal is partially achieved, you just go with goal partially met. And if the goal wasn't achieved, you just go with goal not met or goal not achieved. Then you bring your date and your time that you evaluated it. And if your goal was achieved, you can take that one out of your nursing care plan and focus on the others. If goal was partially met, you can decide to change your orders, amend your orders, or go back again with that same orders to ensure that this time you achieve your goals better than earlier. And if goal was not achieved, it simply means that this time you have to go back again and plan the care.